one here. Would it be better to have surgery separately, or you could have surgeries in one go because of your anesthesia and recovery time? This person says, I'm interested in tummy tuck with lipo and mastopexy augmentation. What are you interested in? Yeah. I'm looking at getting surgery for a tummy tuck with liposuction and possibly breast uplift with implant. I had a hysterectomy 3 years ago with poor care and got a kidney infection and paralytic ileus, which led to twisted bowel, and then developed sepsis. So surgery is daunting to me. All right. Well, that person there, yeah. Well, so I think any surgery would be daunting to you if you've got all those problems. So yeah, you need to think about any surgery. But in general terms, whether to have them together or separately, the hydroxychloroquine for the lupus isn't an issue, I don't think, Nikki. I don't think hydroxychloroquine is going to be an issue, although I would take advice from your doctor who's looking after it, because I'm not an expert in that. So I would take advice on that, but I don't think that'll be a problem. But just in general, talking about, I mean, times have changed, to be honest with you, and tummy tuck with lipo and breast surgery would normally be fine. So-called mummy makeover, pretty routine to do, pretty standard to do. We have been doing some. I have done some of these types of operations, but usually on the lower end of the spectrum. So maybe a tummy tuck without lipo, maybe a breast augmentation. You know, a tummy tuck with lipo and maybe a breast augmentation with implants. That's sort of that's expanding the time out. So we're taking these on a case by case basis because we are limiting the amount of surgery that we can do, and so particularly with the new lockdown, and being very aware that we don't want to put pressure on the NHS and aware of the amount of surgery we do, I think we will be a bit more reluctant to take on bigger operations like these. Not because it's unsafe for you, it's a safe thing to do, and it's something that used to be routinely done back in the day. But I think with all of the COVID issues, we are limiting the surgery time, and we also want to limit the risk of people requiring any help from the NHS, particularly in terms of intensive care. And certainly a longer operation, longer surgery does potentially increase that risk. As I say, it's never happened to me. No one's ever had to have that help. But on paper, it has happened in the world, and it will happen more likely on a longer operation. So I think these joint operations are going to be curbed somewhat during this time until things can get on a more even footing. Once things are on an even footing, we're not so worried about the capacity in the NHS, and we're not so worried about these problems, then certainly it would be possible to do, tummy tuck with lipo and breast surgery at the same time. Although, even though we can do them both at the same time, if we were in a situation where we could, we would have a discussion with you to see if it was right for you, because it's quite a big op. It is quite a lot to have both of those done at the same time, and it does knock you back. But it suits some people because they get one period of recovery. But like I was saying about the lifts with implants and the, one period of recovery, one time off work. So it does suit some people, but it is quite a big thing to do.